you who have decided to come in person, and for those of you who are streaming, we are doing our second workshop on the ESSER funding to get input. And unfortunately, we have one under the weather, one trying to finish up his vacation for summer, and one that will be late of our board members. But nonetheless, we are here and we will take notes. And at this time, I would like to turn the meeting over to Mr. Pye.
Thank you, Ms. Robinson. Yeah, tonight we wanted to follow up on our first workshop by continuing to offer the second in the series with getting public input on the use of ESSER funds. As you know, that comes with a criteria that we have an updated school reopening plan for 21-22, and it's based on ESSER III funding that's there and how we might spend some of those funds to ensure safety of our students as well as to make up for the loss of learning brought on by the COVID. So with that, we're going to have a workshop where we'll have presentations on the safe return to the in-person instruction and the continuity of services plan requirements. So I believe Ms. Canarins has the first part of this.
Good evening. As Mr. Pye and Ms. Robinson said, not much has changed in our proposed reopening plan since our first workshop. We did make a few modifications based on public comment and input, so we'll go ahead and go through that reopening plan again, and we'll be giving an update, a brief update during Mr. Pye's State of the District during the board meeting as well. So we'll get to hear it a couple of times this evening, and plus this information is posted on our website right on the front page so that it's easy to access for everybody. So as we all know, that the reopening plan that we had from June of 2020, we followed all along the way last year, making modifications as necessary based on the health conditions and the advice of the State Department, DHEC, CDC, and our other medical providers. As we moved into, or are moving into, the 21-22 school year, we had to again review our plan and make any modifications or updates in these 13 or 11 categories, I believe, 11 categories in order to meet the requirements of the ESSER funding. And so we'll go briefly through those categories as well. The first one is we had to address the universal and correct wearing of face coverings. As we all know, as recently as July 29th, CDC and DHEC have continued to strongly recommend the mask usage, even indoors in public school settings where physical distancing may not be possible, and especially for the unvaccinated. The exceptions to their face coverings had not changed. Children under 2, anyone with trouble breathing, or unable to remove the masks without assistance. So in our districts, in accordance with a state budget proviso 1.108, that will prohibit mask mandates in public school settings. Naturally, Dorchester District 2, like all the other districts in the state, I think, don't want to risk losing a substantial amount of state funding, so we will absolutely follow that state budget proviso 1.108, and masks will not be mandatory for students or staff in any of our school buildings, to include school buses. However, please know that masks may still be worn by individual choice. There will be no repercussions for wearing or not wearing face masks in classrooms and in our buildings. We as a district still strongly recommend and encourage, like our medical partners have advised, we encourage the continued using of face masks on school buses in our buildings in order to provide for everyone's health and safety. But again, it is a personal choice and they are not mandated in our schools. Facilities modification is the next area that we had to address. So going into the school year, we will at every way possible, try to seat our students at least 3 feet apart to the extent possible. We will continue to group in cohorts and maintain seating charts for all classes and bus routes. That is going to be, you'll hear that again coming up because that's very important for contact tracing, which is still a requirement that we have to do in our schools. In instances where class sizes may be larger, we will continue to use larger spaces, gyms, cafeterias when they're not used, media centers, et cetera, to relocate larger classes so that they can be more spread out. We have removed plexiglass from classrooms. However, we've kept a limited supply of barriers in our classrooms to be utilized for small group instruction, to be utilized for teachers who may want to continue having that barrier at their desk, or to be utilized if a parent requests that their child remain seated with plexiglass. So we haven't gotten rid of the plexiglass altogether. We still have it at our disposal in order to be able to use it as needed. We will continue with no use of lockers at our middle and high school levels. We're going to keep our water fountains capped, but we have bottle filling stations in all of our schools. So that's a much more better way of getting water, and then the high touch areas are not as prevalent as the use of, and we will be resuming the use of cafeterias. So the schools have worked with their schedules in order to provide for staggered using of the cafeterias, also working with the Sodexo group to be able for the children to come through. In some cases, children may come through the cafeteria and then take their meals to an alternate location where they can better space out. But again, each individual school is working with their schedules and their parameters in order to best facilitate that process. The next item was hand washing and respiratory etiquette. Nothing changed there since our last presentation or since May of last year. We will continue to provide gloves, hand sanitizers, and other supplies. The hand sanitizer stations that we installed all throughout our district in many locations throughout all of our schools will continue to remain in place and will continue to encourage to be used. And we will continue to encourage proper hand hygiene and respiratory etiquette to be practiced all throughout the day. Cleaning and maintaining healthy facilities was the next criteria that we had to address. We will continue an emphasis on disinfecting our high-touch surfaces. The custodial staff as well as the instructional staff had gotten into, I hate to put it this way, but they got into a good groove of being able to clean and sanitize in between classes, and so that process will continue. Again, bottle filling stations. Air purifiers have been purchased and will be installed and utilized in all classrooms this year. We were able to make that happen as a result of some of our ESSER funding. Last year, we had begun the process of installing air purifiers in all of our classrooms that had 25 students or more. Now we're going to go back and make sure that every classroom is equipped with an air purifier. Yes, ma'am.
Just a quick question. Will offices also have air purifiers?
I believe so. Mr. Souls, but Dr. Huggins?
You're talking about front office areas,
Just-
put these in classrooms at this point.
Okay.
But we can expand that as needed.
That's where a lot of people, like front office or something,
Excellent.
Oh, you mean the lobbies? No, absolutely.
Yeah, excellent. And also in the maintaining healthy facilities, the maintenance department will continue the daily flushing of the filtration systems. We utilize the bipolar ionization units so that we have improved ventilations throughout our classrooms and throughout our schools. Again, regular replacement of our HVAC system filters, and we are looking at updating entire HVAC systems, starting with some of our older schools who are in more need of total recalls of those systems, and Ms. Meunier will be talking about that aspect when we do the actual spending plan. As I mentioned earlier, contact tracing, isolation, and quarantine will continue to follow all current guidance from DHEC with regard to this. Students and staff who become ill will be referred to the school nurse who will handle those protocols as we have since we returned to school last year, and we will continue to maintain and staff separate isolation rooms in all schools. As you remember, we put those in place this past year, and so we feel like that it's very important with the virus still out there and the new strands that we keep that in place as another mitigating strategy for the defense. Contact tracing, isolation, and quarantine, again, as I said earlier, we'll maintain seating charts and student rosters in order to help facilitate contact tracing. Ms. Santa Maria, our district lead nurse that you all know and love, she will be again spearheading that effort with all of her school nurses, following the DHEC criteria and guideline for that. We are continuing to limit non-essential visitors in our building and have those scheduled by appointment. That is not to say that we can't have a visitor. We just ask that they be scheduled through the front office so that we can do the sign-in, sign-out procedures with them. We know where they're going, who they're interacting with, so that, again, it all comes back to contact tracing should that be necessary. And I think we have had like PTA folks help volunteering in our schools at Fact and Fee. So our principals, again, have got their procedures in place for those measures. Yes, ma'am.
Could you clarify the non-essential part when you say that? Is there a...
It's just like just not walk-ins off the street, that if you want to have a parent conference that you call and schedule that ahead of time.
So you can have those in person?
Yes, ma'am. You can have parent
IEP,
conference.
504, all those types of meetings can happen in person?
They can happen in person, and we're also leaving the virtual option for those where you're more comfortable with
Right.
that. But yes, ma'am, we just ask that those be scheduled. So really non-essential is just kind of like your walk-in kind of thing. Thank you. Diagnostic screening and testing, we have a partnership with Feder Healthcare Network and other medical providers to refer individuals who may be experiencing symptoms or want to be tested. Maybe they had a close exposure or felt like they were in the presence of someone who had to refer them. We do not conduct those in our own schools, but we do have the partnership with Feder and other agencies. And we will continue to encourage students and staff to stay home. When you're sick, I know educators probably are some of the worst in the world for coming to school when you might be feeling under the weather because you want to do and be with your children, your students in the classroom. And so we are trying to encourage individuals that when they're experiencing symptoms or they don't feel well, to stay at home and get tested if the symptoms persist. Or if anyone in the household tests positive unless the person is fully vaccinated. And again, Ms. Santa Maria handles all of the information for that, and when she's made aware of an exposure, she will do the appropriate contact tracing, notify individuals who were close contacts, and then determine based on their volunteering, whether they have had the vaccination or not, the need to quarantine or isolate, or if they're able to continue to come to work. Okay. We don't, I just want to make sure I say too, that we don't ask anyone whether they have had the vaccination or not. That is up to them to disclose, and it's certainly not any kind of mandatory requirement to enter school. So I think we had that question come up, whether we were going to mandate that vaccines before school, and the answer is no. Vaccination accessibility, as you all know, during the spring, actually the first day that it became available, we were able to set up with Feder vaccination clinics for all of our interested staff. And then in June, well, late May and June of last year, or 2021, we were able to offer vaccination clinics to our high school students who were 16 years of age and older with parental consent. We did that at that point in time because we felt that was a layering mechanism to help prevent the disease, and also too in order to give our high school seniors an opportunity to try to end the school year with a little bit of normalcy. with prom and with graduation and those types of things. We don't have any intent at this point in time to actually offer any more vaccination clinics unless we feel like we absolutely need to. So we will continue again to work in partnership with FEDER, all of the others. There seems to be ample supply of vaccination available right now in many locations, and many don't even need appointments anymore. So we'll continue to post, advertise, and encourage participation, but we won't actually be offering vaccinations through our schools. Accommodations for children with disabilities is another federal requirement of the COVID ESSER funds. Naturally, we will continue to follow current IEP and 504 accommodation plans. We have a supply, and we issued these last year to our teachers. If they still feel the need to wear a mask while teaching and they wanted one with the clear panel front, we provided that for them so that the children could see the teacher's lips. So we still have those available. I was hoping that wasn't mine. And again, proper use of hand hygiene and respiratory etiquette, and we'll make those instructions available on the developmental levels for the children so that they better understand what it is they're supposed to be doing in those areas. We have to maintain our coordination with state and local health officials. And so we will continue collaboration and partnerships with the State Department of Education, DHEC, FEDER, MUSC, and any of our other medical providers. We will continue to review on a daily basis, as well as, on a daily basis, our district dashboard. We restarted that for this school year as of today. Yes, as of today. And so we reset the clock to 0 and forgot about 2020, 2021, and now we've moved on to 21, 22. So as you see that, and again, that's posted every morning to our district website for everybody to be able to see. We also look at our cohort data, and we also continue to monitor the DHEC countywide data every 2 weeks. And again, I send you all those reports as close to Thursday as I can. All right. And that concludes my part of the presentation. And so now Ms. Estep is going to review the continuity of services plan.
Good evening. So the last two topics that we have to address are, as Ms. Canaran said, the continuity of services and the communication plan. So under continuity of services, we have instructional models, student instructional supports, socio-emotional and mental health supports, parental and parent and family engagement, summer learning opportunities, and the Road to Recovery plan, which is all of the plans that we are putting together so that we are able to return back to school. So our two instructional models that we will have this year are school-based instruction, which is our full-time, face-to-face, as well as the opportunity for DD2 Virtual Academy, which is 100% online. And right now we have about 700 students that have opted for that option. We don't have, as you remember last year, we had several going back and forth with hybrid and e-learning and a modified hybrid, but these are our two instructional models to choose from this year. We have several instructional supports to provide for students at all three levels, elementary, middle, and high. I won't read through each one of those bulleted items, but we really try to look at each individual child to see what support works best for them and what works best for their family. So we do one-on-one instruction. We are planning again to continue with our tutoring sessions that we started last year. Those could be in the morning, at courtyard while they're at school, at lunch, afternoon, on Saturdays, again trying to work with all families and students to make it be the best opportunity and option that they have. Again, we have quarter recovery. Consistent parent communication is going to be, as always, extremely important in working with the students to see how their progress is going. Hands-on learning, direct instruction, small groups, Differentiated instruction, again, you can see the list up there, home, even down to home visits, if we need to do home visits to make sure that we are reaching each and every one of our students. Social, emotional, and mental health supports. Yes, ma'am.
Could we go back to that for just a second? I just wanted to ask about the interventions in the elementary school. I know we had talked about it a little bit before at the last workshop, but can you kind of go over how that's going to look? What type of interventions specifically
Sure.
we will have?
Sure. When they start out the year, we always do pre-assessments or screeners at the beginning of the year, and that sort of gives us an idea, along with other data points, how the student did last year, what the test results from SC Ready, SC Pass, RI, MI. We look at all of those data points to get a feel, talking to the teachers, talking to the families, the parents, to get a feel for what the student may or may not need. Do they need enrichment? Do they need remediation? Do they need intervention, or are they in what's called our core group and they're good to go? Once we figure out where they need to be, we actually have a form, particularly for ELA, that we fill out that goes through and gives all those data points and provides a recommendation. We have cut scores and things to know whether the student is eligible for intervention. The interventions can be from having a one-on-one with an intervention teacher. It could be small group differentiation with the classroom teacher in the classroom. We have programs such as System 44 at 3rd grade, Read 180 at 4th and 5th grade, as well as instructional technology programs. So we have a sort of a menu of items that we can have at our disposal to help our elementary students with catching them up. And once they're in an intervention, doesn't mean they stay. We also have a dismissal form when they get to that on-grade level point, and we progress monitor every couple of weeks to see how the progress is going so that we can get them onto grade level and back into the classroom.
So is it the same is that a district thing? Is it the same at all the elementary schools, or is it different at each depending on?
The form is the same, obviously.
Right, but how the interventions are done, is that different?
Those are different,
depending
again,
on
based on the individual student, based on the intervention teachers at the school. We also
Well, I guess my question is, I just want to make sure that all elementary schools have access to the same types and numbers of interventions and interventionists available. Does that make sense?
It does.
Because I know
Yes,
in the
ma'am.
past, sometimes schools have used title money for that, but now that we have ESSER money, it seems like it should be something that is available. Does that
Correct,
see what I'm
yes,
getting at?
yes, that does make sense. And again, depending on the student and teachers and the school, they have access to multiple things to use. The ESSER money absolutely is going towards that learning loss, more than the 20% that's required. So all of our students will definitely have access for whatever they need.
Ms. Eastep, thank you for going back to that, because I had two quick questions, just so I know and understand. The tutoring sessions, in person and virtual, can you explain how you're going to, I know when you're going to do it, but can you explain, does a teacher on her free time or his free time do the tutoring? How's that going to happen?
Normally, that happens after school or with the secondary, possibly before school. We found last year that some of our students wanted tutoring, some of the families wanted them to have tutoring, but they did not want to come in, even after we got back to school, whether it was because of COVID or for transportation reasons. So a lot of times, they would do the tutoring right after school, after the students got home, got a snack, they would get back on the computer and the teacher would tutor for an hour online. So we want, again, it's all about options and accessibility for our students to be able, if they want to do in person, then they can certainly stay and do in person or come in on Saturday if that works better for the family, but we also have the virtual option as well.
Thank you, because I know some of them probably are going to feel like they need to catch up,
Yeah.
especially in the beginning. The other question I had was the individual video recordings for supplement support. Can you explain that?
The individual recordings are a lot of times when the teachers get together and plan, they know that we have students that may be quarantined for 10 to 14 days. So they'll video the main portion of the lesson so that can be accessed. And a lot of our teachers have done that in the past, even before COVID, and posted that to the website to make that available. So it's sort of like going onto YouTube and watching a lesson, only it's their teacher.
That's great. I appreciate it. Thanks.
Okay, so the social, emotional, and mental health supports, again, we want to continue to provide mental health counselors at all of the schools, utilize assessment data to develop lessons and interventions. Ms. Wimberly, that's what I was talking about when you asked your question. And all of the social, emotional, and mental health supports, we listed several items there that fall under this umbrella. Academic planning, career planning, self-regulation, and emotional management. A lot of times, particularly in the elementary school, we see that when students come in, and probably even more now that they haven't been able to be in school as much as what they have in the past, to come in and help with learning how to get along, learning how to be on a team, learning how to resolve conflicts. That all falls under the self-regulation and emotional management. Suicide awareness information, we know that with COVID, we've seen an increase, not necessarily just in our district, but we've seen an increase worldwide, nationwide, and you've heard us talk about Gaggle and Go Guardian many times, that we get those alerts, and definitely has been a good product for us to purchase in order to help our students. Again, healthy relationships, diversity and inclusion, learning how to get along with others and accept others, conflict resolution, responsible decision-making, and goal setting. If you look at these things, this falls under social, emotional, and mental health supports, but these are things that we've been doing for years with our students.
I noticed that you have developed lessons that utilize assessments data to develop lessons. Is that our curriculum, or is that a state standard we use, or?
We use our standards to develop all of our lessons. So when it says utilize assessment data to develop lessons and interventions to support students, we use whatever whatever standards that we have that we need to address with our students, or whatever needs. So let's say that a teacher notices that there's a lot of conflict going on in her classroom. Doesn't necessarily have to be a written assessment, but she sees that that's a need. So she gets together with the guidance counselors, and they have lessons that have already been done on getting along with others. Does
So
that make
is there a
sense?
state standard on this? That I know we.
The guidance counts.
Just guidance.
You just said the word, standards, or guidance standards they follow. Where we are with this in our planning is that, yes, we were relying maybe too heavy on some companies and some materials, and I've asked them to move away from that. Like we have, I want to see our counselors who are brilliant. They've worked on workforce development or early thing. We're a leading district in South Carolina. Rather than buying a canned program, we developed our own using pieces from other people's program. There's great stuff out there, but we should pick what we want to use and exclude what we don't want to use. And our counselors are doing that, since it's not prescribed as being now the basic framework can be found in any program anywhere, because the 4 or 5 principles are true no matter what program you use if it's comprehensive. But the support materials that go with that need to be filtered, looked at, so they meet the needs of our standards and where we're going as a school district, and tying with our core values and the other things that we're doing. So I've asked that be done, and great progress thus far has been reported to be is being done with that. In other words, will not be using a particular curriculum in its entirety. And I believe the curriculum that was brought up was CASEL. That is not being used.
Okay.
Now, not to say there's something in there, a unit or something, that we find out of the million units they have that's very appropriate for us to use, but we will pick that one.
Thank
We
you.
won't give the book to someone and say, here, it's the whole program, you wade through and use what you want. We'll set the range of the things that we want, grade level specific. Some topics are great for first grade, they're not appropriate for fifth. There's a lot of topics not appropriate for first grade that might be appropriate for fifth. So we've got to watch developmentally too, what may or may not be appropriate, what's appropriate for our community, what's appropriate for, our teachers are just overwhelmed with so much to teach.
Right.
And when we get through teaching the basics, there's not a whole lot other. But we all know that after COVID, without looking at the social emotional piece, we could have some real issues. We are having real issues that we have to deal with. If a child is not healthy there, they're not going to be healthy to learn. So we know there's a high correlation, but how far we go into that, I think, is what we've always done, and we just don't have the staff to offer what we would like. I know with the ESSER money, I would like to see not only more mental health, the therapists that we get, they're much reasonable to get it through the state if we can get them, we can't find them, and now looking at social workers. Because when we get into a home, it's not just a social problem. People can't pay their bills, they can't do other things that are leading to their other problems. And so if you've got different people in different areas supporting those families' needs, we can't conquer them all, but we can make an inroad. And we've never had the luxury of having that. A lot of school districts have that component. But again, that will be funded by us with ESSER monies if that's chosen at the end of the day. It's part of our whole program, but we're not wrapping anything around any one group of people, and certainly not one program. It's a lot out there, and we can only do so much, so we want to pick the most meaningful, the one that's going to make the biggest difference, the way Dorchester 2 likes to do business.
Well, I think that's comforting, and I think parents needed to hear that. And I think every district is kind of different.
We're different.
So, thank you. I appreciate that.
Thank you, Mr. Pye. So it's taking the best of the best, so to speak,
That's-
from the programs and meshing them together and making sure, like he said, that it is appropriate developmentally and every other way. So thank you for jumping in there. The next one is parent and family engagement. We're excited to share that we are opening up another parent and family engagement center. So this will bring our total to 5. Last year, we saw a great increase in our parent and family engagement centers with Ms. Teresa Kelly and her liaisons working through those. A lot of virtual storytelling, a lot of parents reaching out for assistance since their students were at home. We did parent workshops on how to use Microsoft Teams and to help them through. So we're excited to be able to add another one, and that's going to be down at Windsor Hill. We plan to continue to provide workshops and activities on a monthly basis. Again, we know that being able to help our students be successful, we need parents and schools and the district all working together. And then, of course, we're going to utilize social media to promote at-home activities to support the parent and family engagement. So we're real excited about this piece of it. We had a great summer with our summer learning opportunities. Not only did we have a lot of them, but we had quality ones, and we definitely have seen progress. We did remediation, we did enrichment, we offered continued support for our students. I feel like we had a really good turnout. Particularly at elementary. We opened it up K through 5 this year, and it was really good to see the students come in, and even though it was a long and tiring year, they came in and they worked really hard, as did our teachers who came in during the summer and pretty much gave up their summer vacations to do this. So we will definitely continue with the programs that you see up there, offering the supports sort of as an extended year all the way around for our students into this next year, and then all the way through 2024 with our ESSER funds, but we'll continue with those programs as well, maybe not as large a capacity without the ESSER funds, but we certainly will not pull those supports away from students during the summer that need them. The last part of our plan is the communication of our plan, part of what we are doing here tonight in sharing it with the public and getting input and feedback. Again, probably the best place to go to sort of absorb all of this is our website. Ms. Rayner does a great job with the Public Relations Department and her team, as well as Shelley Bostwick, with posting everything on there from our live stream videos of workshops and board meetings to all of the paperwork that we put out, all of our PowerPoints, our presentations, everything from Ms. Santa Maria, our frequently asked questions. If you go to the website now, if you haven't been there, when you first bring up the page, you go over to the side, it says Find It Fast. And there's a list of bulleted items that anything that you are interested in, especially for our health and safety protocols and COVID updates, are right there for you to click on, and it'll take you right to it. We also send out emails and calls via Blackboard, as we've done in the past, text messages, whether that be through Remind or Class Dojo. We try to post things on social media as well. You know, we really want to be transparent and make sure that our school families and district families know what's happening and know where to find the resources or know who to call or email when they need to get a question answered. So I think with that, then I'm going to turn it over to Ms. Meunier, and she's going to talk about the budget part of this. Yes, ma'am.
I had a couple other questions, just a couple things. I know that we mentioned the cafeterias, that Ms. Karen said they would be open. That's correct. Does that include ILT in Rawlings in the high schools?
Yes.
Yes, okay. And then one other question I had about the quarantine. Is the time frame for quarantine going to be the same as before? Has that changed at all?
Is Amanda here? I'll let her
Sure.
explain.
Thank you.
Not that I couldn't, but she
Sure.
does such a better job.
I absolutely understand.
Yes, so the only change really to the quarantine requirement at this point is for fully vaccinated individuals. So individuals who are at least 2 weeks from their vaccine, their second dose of their vaccine, as long as they're not having symptoms, they're not required to quarantine after an exposure. They just have to monitor for symptoms. But otherwise, that quarantine period for close contacts is the same, 14 days from last exposure, unless you live in the same household, and it could be a little bit longer.
And I know we said we aren't going to ask people about their vaccine status, but are we going to require them to prove it if they're saying that they're vaccinated in an exposure situation?
Right, so when I speak to them about a close contact exposure, if it's a staff member who discloses that they've been exposed, or if we have a situation where there's an exposure at school, I let them know that if they are fully vaccinated, that would change their quarantine requirement, give them an opportunity to volunteer that information to us, at which case we find out when their vaccination was, make sure it was within the correct time period, and then we go from there.
Thank you.
You're welcome.
Good afternoon. So all of these great plans that we're talking about take money, of course. So the American Rescue Plan Act was passed earlier this year. So this is the federal legislation that encompasses the ESSER III funds that we've been discussing. So our ESSER III spending plan for Dorchester District 2, our allocation was $40,526,982. Of this amount, it was so important that the feds wanted us to really hit hard on learning loss, to address learning loss. So their requirement is at least 20% is to go towards learning loss. For our amount, it would be $8,105,397. And the difference between the 40 and the 8 can be used in the remaining 15 categories. Part of our ESSER spending plan, we are required, as y'all have heard tonight, to get public input, which this is another public input meeting tonight, which we had the last one on July 19th. We must complete and submit our spending plan application by August 24th. So this is all part of our process of getting our spending plan together. So the 15 categories that we have to spend the monies on are the same as what we had in our previous ESSER II plans. We had spent a lot of money in categories 4, 5, and 6, which were getting together our cleaning and sanitation supplies and training for folks to know how to handle these diseases. We have spent a lot of money in those areas previously, so you may not see those categories in this spending plan. We also have ESSER II money to continue those categories. We also are allowed to spend money in education technology, mental health supports, which has been big that we've been discussing. Again, the summer learning loss, and also for school facility repairs and improvements for indoor air quality. So again, we are required to take public input. So as we discussed at our July 19th public input meeting, we got information from members who were there, folks who were there. We did an online survey of our community members, parents, students, staff. Since then, we have received additional feedback on our website after that first input meeting, that Ms. Rayner gathered the information for us from that. We've also had leadership meetings, we have cabinet meetings, principal meetings. So taking all of this information together, gathering all this information, we've come up with these target areas. They're consistent with what we've introduced the first time. The biggest area is class size reduction. So in order for us to reduce the class sizes for students, we need to hire additional teachers. That was the number one suggestion by everyone, hands down. Also to purchase educational technology and the infrastructure to support that technology, mental health supports, as we've been talking about. We also must measure the assessments of student learning. Learning loss is big for tutoring and after-school programs. We've included that in our plan. Indoor air quality and facility upgrades. So based on these target areas, we have prepared this proposed spending plan with these dollars. So these are the categories that we had identified. So our allocation is shown at the top. It's shown as a negative just so we can show what the running balance is, $40,526,982. So for our first section, for planning and coordinating for continued education during long-term closures, this is where the state, the feds identified for us to include online learning. So we still have some students who are going to be learning online. They chose to be in a virtual program. So this amount is to cover us for the next 2 years to be in the Low Country Virtual Academy and to do in-house virtual learning. The next category is to purchase educational technology, $3.5 million. We have a gaggle renewal. This is for suicide alerts that Ms. Estep was talking about. An HMH student subscription. This is for math and read 180 for all levels. Edmenum for 3 years is instructional software for middle and high for all the core content areas. We have also included special education, continuing technology that they have been utilizing, so this is for them to continue. Technology infrastructure, we have so many one-to-one devices now, we have to beef up our technology infrastructure a bit, so we needed to update our outdated servers. We need updated power supplies, additional internet circuits for all of those additional technology traffic. And then to replace the iPads and student devices that we're talking about since we are 1-1 district now. For mental health supports, as Ms. Estep and Mr. Pye were discussing, we have a mental health counselor contract with Dorchester Mental Health. That is to provide more mental health counselors through that contract. Also, as Mr. Pye was discussing about the social workers, this would be something new for Dorchester too, where we would be able to reach students who are in need at their home, whereas the mental health counselors meet them at the school. The next area is summer learning. So we had summer programs, as Ms. Estep said, for this summer, and then to continue for 2 more summers, to continue those programs for the teachers, for their pay, for the supplies, and for the transportation. That category in number 10 would cover summer school for the next 2 summers. Learning loss, that is the big area where we are required to spend at least $8.1 million. So right now we've allocated $13.2 million. This would be after-school tutoring for 2 more years. We have after-school tutoring to continue in the ESSER II monies for this year, so this would be for 2 more years. We're hoping to get all the way out to 2024, which is the last date that we can spend these ESSER funds. We've also included formative assessment platform. This is something that's required for us to assess student achievement to see that they are recovering from their learning loss. We've also included long-term subs for each school. So for the larger schools, they would get long-term subs that would be able to go right into the classroom. If someone calls in sick and they weren't able to get a sub, we have these long-term subs right on campus for them to be able to go right into the classroom. We've also included additional teachers for class size reduction, since that was a big big area. We've included 20 teachers for FY23 and 25 teachers for FY24. So this will really help us to cover those, to reduce those class sizes. We also have included class coverage by teachers and incentives. So we have an incentive program that if a teacher is able to fill in during their planning period, they would receive additional pay for that, so that they're helping out with students in that way as well. We also have math coaches. This is something that they felt that all groups felt this was very important to help us with our learning loss, to address the area of math. So this would be to cover all the elementary schools and the middle schools with a math coach. Something new and exciting for this current year and for the next 3 years is the CERDEP all-day 4K program. So this is something that was an initiative by Governor McMaster. He brought this to light last year, and we have qualified to have 9 of our schools be full-day 4K schools to be covered by the state with monies. So 6 of our schools would not be covered with that CERDEP money. So we would pay with general fund and with these ESSER funds for the next 3 years.
So how many elementary schools won't have that?
All
All of
15
them.
will have
All
full,
15.
full
The
day
other 6 is
4K.
what I think was trying to say.
9 of them qualified for CERDAP services.
Okay.
6 of them do not, so we will supplement those 6 so that we have full-day kindergarten.
At every school.
4-year-olds, excuse me.
Isn't the 4-year-old program is fully funded by federal, isn't it?
No, ma'am. No, ma'am.
No, we don't qualify for any of the 4-year-old funding.
We
It's
get
up-
some 4K funding from the state
Very
at this
low.
time, and then the general fund pays for it, but it's only for half-day program.
Yeah,
So
I
this
was just thinking
CERDEP
that
program-
somehow, I was thinking it was paid for by-
And then it's got all the strings attached to it for who can apply and who can't, and who can be accepted, doesn't it? Those are federal, all based on poverty level.
Yeah.
But this 4K is open to every child? Yes,
Not
no?
necessarily.
Not
They
nec-
have to go through testing.
They still
Is
have
that
to be
still-
tested to see that they have a weakness that needs to be
Gotcha.
dealt with.
Okay.
And then it's put on a scale. If we have 50 people applying, only 20 slots, then the poverty and you know, education of the parent, there's a rubric they use
Utilize screeners for that.
that qualify the children. But I think this late of us getting it, a lot of parents have already made plans for their 4-year-olds, so we may have a hard time. But I have to say, as they started getting the word out, a half dozen parents I've heard have called the district and just wept and said they've been so worried about their children's education and getting a start, especially after this COVID stuff, and wanted them to get off to a good start, and they can't afford the programs the churches and the community has, and that this is a godsend. And that even though they may have had child care plan with grandparents, whatever, they're going to jump. They want this so bad that they'll do anything to get the child in the program. So
So-
we think it'll be a hit.
But will we have less students since it's full day? Because normally we had two half days.
We're going to do both.
So we're going to have the 2 half-day programs and then 1 full-day program.
Well, where we have the need, a lot of our schools don't have the number of kids. And when we get like I said, this late, a lot of them have already made plans, and half-day has never been super popular because of the child care options. Laura, you want to add to that?
Most of the other districts.
That was announced before we were ready to announce it. That's coming from my new goals. We worked it out in the old goal, but the new goal is going to tell what it's going to be, because we're still working on it.
Okay, so we will not have any half-day programs because, as Mr. Pye mentioned, most of the parents want the full day. And so as we've gone through, and Donna Alexander and Dr. Franklin have worked with the parents, we've called all of those that were accepted throughout the summer, that enrolled and did the screening and qualified. We've called all of them to see, are you okay, full day? And again, as Mr. Pye said, most of them are extremely excited. So to answer your question about will we have less, In many cases, we are adding another 4K classroom. So we'll still have the 40 students. It'll just be all day long, which is much better because the research shows
Oh, okay.
full day is
I
much
was
better than half a
misunderstanding.
day.
That was- We lost 20 somewhere, we can't lose it.
No,
Mr. Pine, most of
we,
the other districts already have full day anyway.
They qualified for it.
they
so we had
qualified,
never
yeah, right,
qualified.
Oh,
right.
okay.
And when
So,
they finally
and-
told us we could do it, we put the grant in, they alerted us, we were so excited that 2 schools were picked. Then we told them we had reservations if it was, we needed to do that for just 2 schools. And we got a call within 24 hours that it went from 2 to 9.
Right, because
Some will
they
call 'em
actually
again, hoping
changed
it'll
the
go from 9 to
percentage of poverty so that we could have more schools to
Yes.
qualify. So, those 9, most of them qualified for the 2 classes, so that's good. On top of, they are also paying for the furniture for the classroom, so that's even better.
And I guess, to fast forward, if we still have a waiting list, I don't like waiting lists, we'll back up and punt, and we might could use then ESSER funds, at least this first year or 2, to make sure these kids get a chance to get a good start. So I'm gonna put as many in as we can put in.
Right, and we are still, as parents are calling, we are still doing those screenings so that we can hopefully fill all of those. And again, as Mr. Pye said, if we need to open up another class, we've got one school that's on the I guess the border that could possibly end up with 2, that right now has just got enough students for 1, but we are monitoring that every single day and getting the students assessed. The State Department too, just so you know, I know 4K or school opens next Monday, but they have, because of their lag in time in notifying us, which wasn't until the 6th of July, they've allowed us to, if we need to, start as far out as Labor Day, right after Labor Day. We're going to try to get everything ready, get the rooms, get the furniture ordered, make sure all the students are ready, but just know that we might have to do a staggered schedule, which we do with 4K anyway the first week, but we're going to get all of our babies in there.
And you have enough teachers?
Yes, as of right now.
You
it's
will not
looking-
believe it. I mean, we've got we're having a very slow registration, so we still don't know what's out there. And we've done, like I said, we've hired every good teacher we can put our hands on, and we have enough in the elementary to do some shifting that all those classes will be covered.
Okay.
Well, I didn't mean to burst your bubble and you're surprised, Mr. Pye, but I'm going to ask Lori to stay up here because the next item, she can probably explain much better than I can, is the pilot for the 3-year-old program. Lori?
That's new too. That's a new idea. As of last Tuesday or Wednesday, wasn't it, Thursday? We just came up with this, what
You're
we're gonna do
talking
with
with
third.
Waterford?
Uh-huh.
Okay, so, yes, this is still very new, and so I will share what I know so far. In talking about how can we reach our students early, we met with a company that does our Waterford for K and 1 and also does 4K with a technology program. So we met with the representative last week, as Mr. Pye said, and want to get our family engagement centers with Ms. Kelly involved with reaching out to our 3-year-old community to also try to get them involved by visiting homes and so forth. So we're still in the works with that. The lady is coming from Texas again this Friday to meet with the elementary department and have some more discussion on what could this look like and sort of dream big and see what we can come up with and develop so that we can also get our 3-year-olds, not only get our 4-year-olds full day, get them started, but see what we can also do for our 3-year-olds.
Well, this is start out in the homes, they won't be coming to school, but getting the parents engaged early between the centers and this program that's found to be very beneficial. At least other districts are telling us this around our state. So it's a start for us. The earlier we get in these homes with these students, the better chance they have. And we won't have to spend every year with interventions. If we catch them up early, they can blossom and bloom and get ahead instead of always having to try to catch up. So we're a firm believer that, and I'm glad the governor is finally seeing the people in Columbia that it begins at the early ages. And we didn't have the rooms, but have it be with the blessing that we went 1-to-1. We freed up 111 rooms, so I don't have an issue with the rooms. And many districts are having to turn down some of these initiatives because they don't have the space. We would have had to do that up to this year, so good things happen to us sometimes.
So that was the fun category right there. So we have allocated $13.2 million specifically for addressing learning loss, which that is over 32%.
Before we leave that, I was just going to ask a couple questions about that. So the adding more teachers, additional
Yes.
teachers.
Yes.
Do we have any idea yet about average class sizes and how that's going to be changing? Obviously, I know.
Well, as Mr. Paz said, we have.
We should
slow
not exceed,
registration.
I know that, right.
this class sizes we've always had, probably we factored at least probably drop it 1, maybe 2. Based on the numbers, the way they're coming in, if it stays this way, that should hold up, but at the same time, it may drop another 1 or 2. So we could be in the lowest numbers we've had in history. Over across the whole district, we've always had a kindergarten class, maybe at one school to 18, while there are 26 in other classes, because we do it on a district average based on the size of the school, causes how many classes they have and dictates that. But the way we're looking at that, it appears that we could be in for some good numbers. First grade, we try to keep it average of 19-1. It could be, we'd love it to be 15 and 16. And a lot of our schools are paying with their title money for class size reduction, 1 and 2 teachers. So they're already dropping them on their own. We would drop it on top of that. So that's why I think we are in store for some good size, nice classes. We have 2 5th grades in the district, or the many 5th grade classes, schools of the 15 that look like that those schools might hit 25 or 26. That would be a perfect place to do an extra section. If the school's not already doing it, we do it, then that could drop it to 22, 21. For 5th grade, those would be exceptional numbers. And other grades like kindergarten usually runs 25, 26. We're hoping to get it around 22. Those are the numbers we're hoping for. Again, depending on the number of students, I hate to wish that they don't come because I want them all to come back, but at the same time, with the social distancing concerns that we always have issues with, and the learning loss we've experienced, the lower the class size, the more effective the teacher can be. So that's, we're kind of double-edged sword there.
Exactly.
Okay, thank you. And then one other thing, the long-term subs. So will every school have one long-term sub? Is that how that's
We
working?
had talked about
Tell 'em
at
that
least
story.
1. So the high schools, since they are a larger population, they would have 3, I think.
And the middle,
schools,
2. And every elementary, 1.
Great, great. Yes, thank you.
You're welcome. So the next category that we have is concerning projects to improve indoor air quality. So when we had our facility study last year, it was presented to us that 4 of our schools, some of these are our oldest, were listed as critical needs for total replacement of their HVAC systems. So we have, it's frozen. So we had, we've included $8.9 million to replace 4 AC systems at Span, Summerville Elementary, Knightsville Elementary, and Gap. It hasn't shown up yet, at least the computer is frozen. So we had $8.9 million there. We also have in category 14, this is for developing strategies and implementing health protocols to continue our emergency paid sick leave. As we have seen some folks who may need to be out because of this variant, the district has authorized 10 days for sick leave that would be paid through these funds for someone if they are quarantined or if they're out sick. You would get 10 days. Right now, we have that through December 31st. That's no longer a federal requirement, but that was something that the district felt strongly about continuing because of the situation. We'll continue to monitor that, and if we see that there's a greater need later down the road, we can always amend this and send the amendment to the state to ask for more funding in that area. We also have UAPs at each school. we felt that that was important to continue with those folks. So to continue those for 2 more years, hopefully this won't go for 2 more years, and we can reallocate those funds for something better later. And then our last section is other activities to maintain operations and continue education and employment. So the South Carolina Arts Commission gave us a great presentation about how they were working with the state and through using ESSER funds, and they are going to be issuing some grants, and asked if we could use some of our ESSER monies and some of their ESSER monies, and we could work together to increase our fine arts. So we've been working with Jason Walsh and his folks, and the high school folks, middle school folks, for instruments, to increase the media arts, for piano tables, etc. We thought $1 million would be a good start there, and hopefully we would get a grant from the Arts Commission to help in that area as well. And the last column, the last category is indirect costs. We had talked about this when we were working on our budget, that federal regulations allow us to charge indirect costs of the grants for us to manage these funds. This is a lot of money. So for us to manage it on the general fund side, we are able to use indirect costs. So this is our rate for Dorchester 2 for our indirect cost rate is around 17%, but we didn't feel like we should ask for 17% out of the 40 million, so we just asked for less than 10% for 3.5, and we did build that into our general fund budget to help us with our general funds. So of the 40 million, we have budgeted 38.5 million, so that still leaves us total unbudgeted of 2 million. If anybody has any ideas for 2 million, or we can always put it in other for right now, and then as we see what our needs are as we go through, as we're working on learning loss and working on these different areas, we can always amend again.
Ms. Minier, can I ask something? That 2 million, this has been a black cloud, obviously COVID has, and a silver lining is money has just rained down all over the nation, but when that money dries up,
Right.
You can't save any of that for later. It has to be spent, correct?
Right, that is right.
So are we going to be in a
Well, we've talked
bad
about that. Many
point?
times we've talked about that. We're like, well, what about these programs after the 3 years?
Exactly.
And after the ESSER money goes away?
The only thing will be the teacher allocations, because that's a high-ticket item. It'll pay for it now, and then we'll see at the end of this year who shows up and who doesn't, and then that's a year of learning loss we were able to make up. We should be able to do it a second year, but by the third year, if there's no more funds coming, we would have to then begin to dwindle that down so that we can have recurring expenses and be able to meet it. So we won't be able to fund that. This is going way out there to help us. That's what the money was intended to. Immediate help. 3 years shot in the arm to try to see if we can't counteract some of the situation. But after that, we still have a funding issue in South Carolina for all public schools, but particularly our school district, when we are in the bottom 5, in the top 10 of 80 districts of what we produce, but in the bottom 5 of the monies we get, with other districts having more industry and the way the state funding goes, they're just favored over us, and the rich get richer and the poor get poorer. And we're not poor enough on the bubble. We're proud poor, but we're not poor enough to qualify for all the federal grants and things. So we apply and they say, sorry, we can't fund you. We have other districts that need more. It's the same districts over and over and over. There's no way they can spend all this money, and we're just begging for it. So all this has been quite a surprise for us to be included in the package and it be given evenly without all those strings that are attached. And of course, and they've given a lot of leeway on how we can spend it. We're trying to, if we buy a new computer program, we want it to last for at least 3 years. We're paying the 3-year membership or whatever it needs to be to get it. So we're not having to worry about those recurring costs. Any funds we have would go to our main sources, that's the teachers, to fund our teachers. And we're not allowed to pay anything towards salary. We're not allowed to, so we can't pay for teachers out of that. I'm not paying for this really out of it. We're using that funding to support the learning loss at this time, but it's not recurring. And after 3 years, we have to find another source of money. So it's the way it's always been, but we're gonna get what we can while we can.
The teachers that we are hiring for class size reduction, those are being paid salaries and benefits out of this money.
Right.
And as Mr. Pye was saying, through attrition and after the 3 years, we can suck them into our teacher
Because every year
roles.
we lose maybe 150, 200 teachers. And so we can look to see if we're over, we can continue to do that. But with the teacher shortage, this was another thing we had to do. We had to get them while we could because they're not going to be out there in the next year or two. So if we can at least be caught up,
Keep
then
them while we have them.
we can just work on that funding. At least we have a chance, rather than if we got the funding, we couldn't do anything about it anyway because there'd be no teachers. And we do have a few rooms, so we can probably make it. And we have all of our portable units. As much as I don't want to use those units, we still have a large number of those in the district. That's not counting those 100 classrooms, so we may have 200 classrooms. So we can grow some if we need to keep the class sizes as low as possible.
So next steps,
Can I ask one other question, just when we're talking about that extra money? And I know I asked this at the last workshop too, but is there any, have we looked at it, we talked about all the possibility of having a technology specialist in every school? I mean, we just have so much technology now.
We could do that. We talked about that, matter of fact, a long
Right.
discussion on it
And
this morning.
So how many do we have in the district? I know,
We have like 12.
we have 12.
So
And
we would need 13 more to have one per school.
it just seems like with all the technology that we are using now, which is
Well,
still so new, I didn't know if that was something.
Most
we
of it
could
is
consider.
covered by us giving it out and taking it up as our problem. But everything's under warranty, and it's all handled with
Well, and I
Canty.
just mean the day-to-day issues that come up, because I remember from visiting schools, it was something that came up in every school. I mean, there's like whole just rooms and people devoted to trying to maintain that. And so I was just, I don't know, I was just curious.
Was it not like the last, my understanding, now what, I don't know that to be true, but it was like the last week or two of school, the first week or two, taking them up, giving them out,
I
back
think
and
that is
forth.
certainly a big job, but I also think just the day-to-day, I mean,
Day-to-day?
anytime, I mean, students have anytime they have an issue with their device, which I think happens probably when you have that many students with, you know, I just was wondering if it's something we've looked at or considered.
We've
or-
looked at it, and it would be with the shortage, there are no teachers, for high school and middle, basically, they're dried up. So I don't know what we would do about that unless we took the ones we had in the district and put them there and try to pick the elementary where we may be over.
Right.
And we don't always, and if we can get by with class sizes at a certain number and not go lower, then we may have teachers available, and I want them in a productive job. We don't want them just free. We want them doing interventions. We want them doing that. They can maybe an ideal plan would be half of the day the intervention, the other half the library, doing the technical stuff.
And it may be that, I don't know,
We could
but
do
maybe
double.
that some schools have more of a need than other. Obviously, some schools
Some
have more
do, some
students.
do.
So that could be, you're right, it might not be the same need at every school. So I don't know, I just.
I know
mentioned
one, because
that.
I'm a friend with the librarian, she was mine many years ago, and she keeps me informed, and she is not happy. And she represents
Well, but
many
I also
others who she
just,
said
I'm
aren't happy.
concerned that, I feel like the media centers are so important in the schools.
They are very important.
And just from having kids in the school, I know that their job is just essential in what they do,
Well-
the role they play, and the involvement and just
And they may not have the
teaching, you know,
space either to
So.
have things laying out and be worked on, checked up with. That's very important that we secure these things. So
Mm-hmm.
I know Summerville High School has a separate room outside the library,
I remember
and they
seeing
have their own employee. They took a secretary
Right.
from her job, and they made her full-time the computer, and I don't know who all was assisting her, but
Right.
she seems to be doing fine.
And so it could be just at some schools there might be, the situation might be different than others.
But we're looking at it. We talked at great length about it this morning.
Okay,
I
thank
wrote
you.
that
It's-
down,
it's
maybe
on
as
the
part of our
docket.
unbudgeted amounts, we could maybe talk about including that.
Thank you.
So our next steps, we are moving towards we're on the blue square now. We're having our board workshop and public input meeting on the proposed ESSER spending plan. We're also going to have the website available for additional comments after tonight's presentation. This will be on the website. Thank you, Ms. Rayner. And we'll accept more input from that. And then once we receive the rest of the input, we'll bring you one more time on August 23rd at the board meeting, the final plan that we're going to submit to the state on the morning of the 24th. So with that, do we want to open it up for any comments? I wrote down your comment about the devices for public input on any items,
Public input?
even on the reopening plan.
Yeah, is there any public input out there? Anyone want to make a suggestion for us as a district with that extra little bit of money?
How to spend the money.
So I see a hand. Would you like to?
I don't have input on necessarily a suggestion for that, but I do have questions in regards to the reopening plan, so I don't know when would be the appropriate time.
Now, ask the question.
What, just sitting here?
Yes, ma'am, you're fine.
Okay, my first question was,
Something.
last year I spoke with many teachers and students afraid of unmasking, and I did see kind of the contradicting statements with the ESSER fund and now with the provision, how, you can't mandate masks, which is great. I absolutely love that. My question is, what are you doing to, protect teachers and students who decide not to mask? And is there repercussions if teachers treat students differently, or try to persuade them, or coerce them, or make them feel bad if they're in the classroom for not wearing masks?
Well, we had people last year to tell us once we did this that people were separating kids. We investigated every situation brought to us, maybe not, but like 4. Not one of those were found to be true by anybody, any place. So it was a misunderstanding or whatever, and we would know the child that the person said there. When we looked in the room, it was like she and a friend were together. They might have been in the back corner, but that was their seat all along. They've been sitting there all year. So nobody was moved as a result of that. We're dead against that. We don't put free and reduced children differently. We don't wear tags around our neck identifying kids that can't be labeled in any way, shape, or form. That's wrong. And so, no, ma'am, that's not going to be tolerated, and I have no reason to think that's going to be abused by anybody. I think we've done it for so long with so many things that it's just common sense. We don't treat children.
Ran into, and I personally have experienced and saw, was just maybe like little statements here and there, like my children experienced. I would never have unmasked my children. I have elementary school age.
A teacher said that?
Just like to the classroom addressing them.
Okay.
Or I feel more comfortable if all you students would wear masks, or things like that. Just these kind of statements here and there, which were I work with a lot of kids. I volunteer in the community a lot, so I've talked to them a lot, and I just wanted to know, are there like repercussions? Is there like a reporting procedure?
Well, first of all, we have to be aware of it. So the only way we're going to be aware of it is for you or your child to tell us. When it happened that very day, it will be looked into and dealt with. If nothing else happens, at least we make awareness, and it's put in our newsletters and things that we're getting reports of this, not pointing fingers at anybody. Please refrain from giving your personal opinions, as we don't get in the faculty meeting and say, everybody but one first-grade teacher knows how to teach here, and she's got severe issues. We would never make a statement like that, and we just don't do it. People sometimes talk and say things and may not even mean it the way it came out, but the child felt like all of a sudden I'm being picked on, and maybe they're not. But we do investigate, and we highly discourage giving our beliefs, any of those things. So we don't talk politics. We just absolutely, now if you're in a government class, I guess where it's appropriate, one thing is it, but we don't want the teachers' viewpoints expressed on any of our stuff that we're doing. They have their viewpoint, I have mine. We have a job to do. We teach South Carolina standards, and I don't think there's a standard in there about belittling children. So, but I appreciate you. It does. No, man, we're not going to do that, but it's strictly going to be up to the parents. And I know last time when we did the waiver, 78% still wore the mask to the very end. Even children whose parents signed the waiver, the child did not. Now that could have been peer pressure on their part, not wanting to be different. They might want, maybe they felt safer. I don't know what the problem was there. We didn't get involved in that. That was a family decision, and we're still honoring that now. We're encouraging people to wear the mask, but there'll be no repercussions for those who do not, as the same thing with vaccinations. We're not allowed, and we don't ask people if they've been vaccinated or not. That's not our business.
And I do have a few questions, so I don't want to
Okay, well, you're the only one talking, so you might as well do it.
I appreciate that you will not be offering vaccine clinics. I do think that it's, that's something that parents definitely can access.
It's running every corner now, so
So
we're,
I'm very happy to see that. I'd like to see that continue where that's not something that's in the school, it's something they're made aware of. But I wanted clarification on what you mean by DD2 will continue to post, advertise, and encourage vaccinations. Where and how will this be done? How often? And I'm just curious, like, what does that mean? Like, is it going to be
All right.
on announcements at school? Are there going to be signs at school? Are
I
there
see.
going to be, like, how is it advertised, encouraged? Like, are teachers going to be?
all right, our nurse will handle that, because that will come from her department.
Going to use the microphone because I know everybody can't hear me. So when we say post and encourage, that's something that the state is requiring that we do because that's still the DHEC recommendation. So we just mean that we're going to post opportunities on our website. So if we hear that there's a DHEC free clinic available for vaccinations at, the Columbia Mall, we're going to post that on the DD2 website so that those who are interested have that resource, just like we do for other childhood vaccines and adult vaccines.
That's perfect. So it's not going to be like my kid comes to school every day and over the morning announcements is like,
No.
your vaccine, child. Like,
No.
I just, I just want
No,
them to,
that's coercion, we can't do that, we can't do
Yeah,
that.
I just want a clarification on that because I was a little confused, so I appreciate that.
Miss Santa Maria, while you're up there, may I ask you a quick question?
Sure.
There's not a quarantine for the Delta variant, is there?
Yeah, it is.
There's a quarantine for any close contact exposure to COVID-19 at this point, regardless of which strain of COVID you're exposed to.
Okay, well, I had just heard that there was no quarantine period for the Delta variant.
The only exception to quarantine at this point is for those who have had COVID in the last 90 days and are fully recovered, or those who are fully vaccinated.
Me.
And
One
you
more.
might wanna state-
Stay up here.
The question is also for you, I'm so sorry. It said if a child exhibits symptoms or becomes ill in school, it will be sent to the nurse. What is the protocol for like if a child exhibits COVID symptoms in class or just any illness in general? Will there be testing at school, any sort of COVID testing, or like how is that process going to work?
Sure. So just like with any illness, if a student is exhibiting symptoms or just looks like they're not feeling well in class, that student is typically sent to the nurse for evaluation. Once the nurse evaluates that student, if they meet the criteria for COVID exclusion, then it's a parent phone call. We let them know that their child needs to be picked up and what that process looks like in terms of their return to school. We don't do any testing on site. We have a partner, Better Healthcare, so anyone who needs a testing location, we refer them there, but we don't do any on-site
Is the
testing.
testing mandated if they're being like,
Nope.
suspected of COVID?
Nope, testing is never required for students or staff, even if they are having COVID symptoms. They would need to either see a healthcare provider to seek an alternate diagnosis, receive a negative test result, or isolate for 10 days before returning to school, but they don't have to be tested.
And then what is an isolation room and how and when are they used?
So they are rooms that have been repurposed. Some of them are classrooms, some of them are other spaces where students who are exhibiting COVID symptoms can wait while they're waiting to be picked up by their parent.
Okay, so that's simply like, hey, you were coughing, sneezing in school, we just want to make sure you're not with everybody, so we're going to.
No, it's after you've been seen by the nurse and we're waiting for your mama to come and other kids are coming in with other things to get a Band-Aid, then we keep them separated so we're not spreading it. But
None of these things are clarified, so I'd rather ask.
no, you ask because people are listening and this is how we learn what people need to know.
Yes, and I know other parents have these concerns, so.
These are all good ones. They're good ones.
Like up for interpretation, everybody call you and go crazy, I'm like, let me get it clarified so we can all feel a little bit better about it. And then, the last thing is you did say something about utilizing the data to develop lessons on social and emotional issues. Will parents be provided specifics on these lessons in advance and given options to opt out? Because some of the social and emotional issues, might involve sexuality, might involve race, might involve, suicide and stuff like that. Like some parents might have certain religious or belief systems that they don't necessarily want like a certain lesson to be taught to their children. So like it says that you're going to be developing lessons, which would make me think that that would be taught at some point, right?
It depends on, again, what it is and how it's being taught. Because if it's a classroom discussion, it has to meet the standards. It's already been filtered by the district office with the staff at the school, so it shouldn't be a reason unless it's an extenuating circumstance like a religious reason or whatever, not just for this, because the problem's going to be there. If the class is in here, who's going to supervise the child that's not in there? You see what I'm saying? So if it's a class activity, they're part of the class activity as they are with math, reading, other things. But like I said earlier, we're looking at that curriculum, and we're forming our own curriculum out we've always done, and not relying on any one situation. So there could still be questions. You know, I have a problem with that. There shouldn't be a lot of concern, because I don't see it happening based on the way we've got this looking.
Would we send,
But you,
I have a hard time understanding the South Carolina standards. I did go on there and like look at health, and I saw, you know, like under health, there was like different lists of curriculums. And then I tried to click the
That's right.
curriculum, and I couldn't find information on that, like what is specifically being taught in that lesson. So then I Googled that curriculum, looked it up, and then there would be like specific issues that I was like, I don't know that that's like it would say kindergarten through fifth grade in health and, you know, sexuality, like what they were teaching in the standards, and some of it was kind of suspect. So if we had questions about that, would we address that with you directly?
yes, ma'am. We would want to know, because there could be something that, you know, passes the eye. There could be a total misunderstanding. And again, it could be the person instructing it could have done it inappropriately. And therefore, it was not what the curriculum is. It was how the curriculum might have been used or taught. And again, it could be the child's perception of it, and goes home to the parent and discusses something that's not fully the whole story. And so but we want you to look at it and feel comfortable to ask questions. And I think anybody would make sure that whatever it is you need to know about the curriculum, they should have it when you get to it. Well, like I said, we're still putting it together. There is no program that I know of in the United States that that we use totally. That's including our language arts, our math, our science. There's just nothing that meets all of our needs and the standards, so we're having to put things together.
We know what you pick and choose, because like I might see stuff that I don't agree with, that y'all don't ever address those issues in, because they don't fit your needs, you know what I mean? But they're still in the standards, so it's hard as a parent, like.
Ask.
What I recommend, can I give you a recommendation? Up north, what they always did for all our classes is they offered us a syllabus, like a detailed syllabus. So like if I was taking social studies, I would get a detailed syllabus at the beginning of the year that would detail the subject matter, and then what we would be addressing in that subject matter. And it never, like I knew each year, like in social studies, we were gonna learn, you know, Civil War, and then it would tell you the specific lessons that were in that unit. And it just kind of left little up for interpretation. Parents knew what was going on, and if I saw something maybe I didn't want taught, or I had a question about, or I was like, hey, we're going through, you know, something specific, I could look at it and then ask the teacher, hey, can I see your lesson plans for this specific subject? You know what I mean? It was called a syllabus. You would get it for each class.
Right. I got them in college. I don't recall ever seeing them in the other grades. I'm not sure what's out there. We will double check. All the curriculum people are sitting in the room that have charge of that, so I'm sure they heard you, and I see some nodding heads, some shaking heads this way, so I don't know what that is, but we will react to that when we go back to our meetings tomorrow, starting tomorrow, and we will look at that and certainly be aware of that concern that you posed.
Just as a parent,
Yes, ma'am.
I can only know so much about what's being taught in the classroom, and I'm very reliant on like either looking at my kids' schoolwork every day, what they personally tell me, or trying to decipher the standards apart from what the teachers are actually teaching in the classroom.
It's so much. It is.
I would like to just know, like, hey, I'm teaching ABC on this day. If you don't like it,
That's right.
or we can discuss it, or you can share your opinions or concerns with me directly, and it wouldn't leave anything up for me to, you know.
Okay, but the standards are the main guide. So if you got a question about a standard and how it might be, you're seeing how it could be taught many different ways. That's where I would center in. I'd like to know how that standard's going to be taught in my child's class. And and we should be able to answer that, because we're teaching it.
As a parent, I don't know any of it, so I'm just trying to figure out how it works, like.
It's fine. It's fine. You're okay. That's an okay question.
I appreciate you, and that's all I have. I appreciate your time.
Thank you.
Mr. Pye, it's a few minutes before 6.
Yes.
I think we probably need to
She
close
was
the
the
meeting.
last one, I think.
You're the
Nobody
last
was-
one.
Nobody
Okay.
was raising their hand but her, so we
Okay.
let her talk.
Well, we've got 3
One lady
minutes if
behind.
you have a quick question.
One girl.
No, you're fine. You ask great questions.
Yes, ma'am. Please come here real quickly, up here. Because your voice is low, and I want to make sure we hear your suggestion.
I was thinking maybe we could use the extra money for better food for schools.
Another subject I had today, and my staff doesn't want to hear about, and y'all would have a fit if you knew what I talked about.
But they wouldn't.
I was picking foods I know you would like. And they're telling me, we can't do that, but we're looking at it. I said, other schools are doing it. I want you to call and find out how they're doing it, and we say we can't do it. And so I pay a lot of money to outsource the food program, and participation, without participation, we can't hire the workers. And without the workers, we can't produce what we need to. So it's all about the quality of food, and if it's not good, you're not going to eat there, and we'll find ourselves in a need of not having a program. And that's going to hurt a lot of these kids who can't afford, they're dependent upon the school food. But I want to make it better. I watch too many kids dumping all their lunch in the garbage can, the entire lunch.
Thank you.
That was
Thank
a
you.
very delicious question.
I heard it, and I'm dealing with it. Thank you.
Could the extra money be spent on food?
No, I don't think so. No. That's it.
Okay. All right. Thank you so much for coming, and this meeting is adjourned, and in about 2 minutes, we'll start the board meeting.